I'm Jaime Hooley. I'm one of the physician assistants at the Marshalltown Clinic. I've always been interested in biology, and so going into medicine was just a natural progression of that. I have several friends who are physician assistants, and they really encouraged me to pursue that field. I've worked as a nurse's aide previously. I worked as a telemetry monitor previously. I worked even in cardiac rehab. So I kind of have medicine, going back to when I was a teenager as far as work experience, and then being a physician assistant was a fantastic next step for me. One of the things that I specialize in is internal medicine and geriatrics. As a physician assistant, I'm able to see all range of ages and different kinds of people, but I focus mostly on adults with their chronic medical problems. As a physician assistant, I see patients on a day-to-day basis. Mostly I focus on geriatrics, which is our older patients, those over the age 65. Those folks tend to have a lot of more chronic health problems, and I love dealing with that kind of stuff. One of the things I find most rewarding about my job is when folks come back for a follow-up on something specific that we did. For instance, a 1-month follow-up on blood pressure or pain management or depression. And if they can tell me that I've made a difference in their lives, that's very rewarding for me. As far as my medical background, I actually have worked in Marshalltown in the medical field for about 20 years now. First as a CNA, and then along the lines a telemetry monitor, a unit secretary, even a little bit of cardiac rehab. I finished my physician assistant training about 8 years ago, and I've been working in the clinic here for 7.5 years now, primarily focusing originally on internal medicine and a little bit of family practice along the way. Hope patients know when they come through the door that they can really just tell me about anything. I try and be very approachable. I really try and educate patients on their chronic health problems without talking in medical legalese terminology. We can sit down, we can talk about their problems in a real way and try and find real solutions for them.